Newton is an associate professor at Pennington Biomedical Center and the director of the Physical Activity and Ethnic Minority Health Lab. He received his Ph.D. in clinical psychology from the University of Florida in 2002 and has been at Pennington Biomedical for 19 years. We also have Dr. Owen Carmichael. You might recognize Dr. Owen Carmichael. He presented last year for a Lunch and Learn for us. And he is a professor and director of biomedical imaging at Pennington Biomedical. He received his PhD in robotics from Carnegie Mellon University in 2006 and has been at Pennington Biomedical for the last 6 years. And I want to give them the rest of the time. And if you have any questions throughout the presentation, feel free to put them in the chat box and we'll go through questions near the end. All right, thank you all so much.
Thanks very much, Ellen. This is Owen Carmichael. And as she said, I was a speaker at this Lunch and Learn series last year. And it was really a great experience because I got a bunch of very, very well-informed questions from the audience. So I'm looking forward to the question and answer period. As Ellen said, please put your questions that you have into the chat and we'll go over them at the end of the hour. So I'm just going to go ahead and get started. The way that we are going to do this is to split up the talk between myself and Dr. Newton. So I'm going to lead us off and talk about what memory is and what normal memory performance is in older adults, and then what memory loss is. And I'm going to start there because I think a lot of people have misconceptions about when their thinking skills are normal versus when do they constitute a medical problem. So I'm going to try to talk about that a little bit. And then we'll talk a little bit about how to preserve normal memory performance. And this is where Dr. Newton will take over. The main take-home message here, which we'll get into, is that there's no silver bullet, but there may be silver buckshot when it comes to preserving normal memory performance. And we'll describe what we mean by that when we get there. After we talk about that, Dr. Newton's going to continue and talk a little bit about why it's so important to participate in biomedical research and why disparities in biomedical research participation are so important and so critical at this time. When we say disparities, what we're referring to is the fact that African American individuals and those from other race and ethnic minority groups do not participate in biomedical research to develop new treatments and cures for diseases, and that's really not a good thing. We'll talk about that a little bit. We'll get into what kinds of research Pennington Biomedical does on its campus. Just a taste of some specific studies that are here and that are coming in the future. And I don't think any presentation about anything in 2020 or early 2021 can avoid the topic of COVID. I think no matter where you are, no matter what you're doing, the pandemic has affected that activity in some way, and we're no different. So we'll just talk about how the Pennington Center has reacted to the COVID pandemic and how we're dealing with it as we do our research studies. So first of all, normal memory performance. So memory actually refers to a number of different things that you do when you're thinking. We usually kind of have a concept of what memory is, but it actually refers to recalling many different types of information in your brain. So we refer to sequences of events, recalling those as episodic memory. So typically if you get home from work or you get home from an outing and your spouse or one of your kids says, oh, well, how was your day? You recall the events of the day. That's called episodic memory, and it's very, very common. We have some deep down sorts of memories that we learned a very, very long time ago, usually in childhood, having to do with the meanings of words. We call that semantic memory. And then some of the most mysterious aspects of memory comes from, again, deep down, sort of deeply etched into you memories from very, very long time ago. And that's called crystallized memories. So for those of you who have had experiences with people with dementia, and specifically Alzheimer's disease, there are sometimes these tantalizing episodes where the person practically cannot produce a sentence of language and maybe doesn't even recognize loved ones and family members. But if you play a snippet of a song from that person's childhood, they will light up and recognize it and be able to sing along. That's what I mean by crystallized memories. They're so deep down in the brain that they seem to stay when a lot of the other forms of memory go away. And then procedural memory refers to sequences of steps or instructions. And so some people who are older and experience memory decline, some of the earliest signs of it is the inability to perform sequences of steps, such as cooking a recipe or finding their way from the house to the bank or some other destination that they're familiar with. And we usually talk about differences between information that was learned long ago, long-term memory, or recently, or short-term memory. So one of the most important messages I'd like to make sure everyone gets is that memory changes even in older adults who are without any kind of a brain disease. So as we get older, we see mild declines in memory, especially that episodic long-term and short-term memory that is very, very normal, in the same sense that if you are a jogger and your amount of time it takes you to run a mile gets slower as you get older, that's not an indication that you have some kind of a muscular disease. It's what happens to people normally as they get older. So, and I think one of the most common occurrences, I've been doing research in aging and Alzheimer's disease for almost 20 years now. And one of the most common types of questions I get is, I experienced a decline in my ability to remember things. Is this a sign that I have a brain disease? And usually the answer is no. So again, mild decline in these memory skills in old age is normal and doesn't necessarily mean that something is going on in your brain. So what about memory loss? What does this term mean? Well, there is a medical terminology for what we call clinically significant memory decline. And the way that you learn that you have clinically significant memory decline is by taking standardized memory tests administered by trained professionals. So these are usually paper and pencil tests. They can be written down or delivered orally by this trained professional. It's usually someone from an allied health profession, like a physician's assistant or what we call a licensed psychometrist, something like a psychologist. And excuse me, your scores on these standardized memory tests are combined with other information from your medical history to determine whether you have clinically significant memory decline. So again, I just like to emphasize this point. You do not self-diagnose with a clinically significant memory problem. You do not determine that you have it on your own. And you don't get it by, for example, noticing that your Scrabble skills have gone downhill. If you forget where your house keys are, that doesn't mean that you have some kind of a serious medical problem. If you have a head cold and you wake up really groggy and you're not sure what time it is or what day it is, that doesn't mean you have a significant medical problem. And also importantly, if your family members make an observation about your memory skills, that doesn't diagnose you with a disease either. Really, having a medical professional test you in a very rigorous fashion and combine all of the information from the rest of your medical record, that's what tells you that you do or don't have a significant memory problem. So dementia is made up of two factors. First of all, scoring very, very low on these standardized tests of memory and also others tests of decision making and other mental skills. And also the diminishment of mental skills has to be so bad that it interferes with what we call your daily functioning. So if your mental skills are so poor that you have problems dressing yourself, grooming, using the bathroom, preparing simple meals, and so on, that's when your memory problems and your other mental problems are considered so severe that we call it dementia. So It's not a great thing, this late life memory decline. Alzheimer's disease is really bad. Dementia is no fun at all. And so I think all of us, even, I'm 45, I'm about to turn 46, and I think about how I can do things to preserve my own memory performance so that I don't decline in this way as I get older. So I think this is a natural question, and it's the focus of the presentation today. So how exactly do we preserve normal memory performance? So I've said this thing about silver bullets and silver buckshot. So um, this term silver bullet, and I think everyone is familiar with the cliche, but a silver bullet is one isolated factor or one isolated ingredient that single-handedly solves a problem. And my message to you is that there's no silver bullet for preserving memory function as you get older and preventing dementia. And I know this because we've tried. So there have been clinical trials where people have been given one or another individual factor and tried to use that to prevent memory decline. And none of them have worked. They've all failed spectacularly. There was a very large clinical trial in which there were two groups of people. One of them got a ginkgo biloba pill. The other one got a sugar pill, basically a fake. And there was no difference between the two groups in terms of one of them having more or less memory decline. Resveratrol, which is usually it's referred to as the thing that makes red wine so healthy for you. Resveratrol extract was attempted and given in the same type of study to see if it had an effect on memory function. It did not. The same thing with green tea extract, coconut oil, vitamin E, the list goes on and on and on, and they've all failed spectacularly. And so, and I do believe that researchers such as myself and the broader community of researchers have really kind of had enough with this kind of study, where we take something like the new kid on the block might be acai berries, and someone says, well, gosh, maybe this is the one factor that's going to prevent memory loss. And most other people in the field don't think that that's actually true. And so those studies have more or less slowed down and almost ground to a halt. Instead, what the medical research tells us is that what you can do to prevent your memory function or to prevent declines in memory as you get older is to have a constellation of different factors, many different factors that you are all doing your best to try to do all at the same time, so that each one of those factors is not itself a silver bullet, but the collection of them together can have an effect. So that's what this term silver buckshot refers to. In a shotgun shell, you have all these very small items that all add up together to have a big effect. And so in this analogy, maybe one of the pieces of silver buckshot is your diet, another one is your exercise plan, another one is how you sleep, and so on. And so that's really sort of the take-home message from this talk, is that there isn't any one thing that you can do to prevent memory decline, but there is a whole set of factors that you can all do together that can have an effect. So at this point, what I'd like to do is hand it over to my co-presenter, Dr. Newton, to talk about this concept of silver buckshot and what we think all the individual, or what some of the individual pieces of buckshot are.
All right. Well, thank you, Owen. That was a great introduction to what we're going to be talking about today. And so, what I'm going to do is I'm going to talk about about six different strategies that people can use in order to maintain their memory. But I think what's important is that the strategies that I'm going to talk about don't just apply to memory. They apply to all of your cognitive abilities or all of your thinking skills. And I'll go a little bit more into what I mean by that in a minute. So these are things that people, research has shown, affects not just memory, but other skills for an older population. So, sure, Owen, you can go to the next slide. All right. So, the first thing that I want to talk about is social engagement. And what I mean by social engagement is that it's really interacting with other people. It's a feeling of being connected to other people, purposefully doing activities and maintaining social relationships. So, really, thinking about social engagement is thinking about interacting and maintaining interactions that you have with other people. And what we know from studies is that by maintaining your social interaction, those people who have more social interactions are at lower risk for developing some level of cognitive decline. So, but what's important about social engagement is that it kind of varies by the structure and the function, the quality. So it's important to have a variety of activities that you engage in. It's important that there's some function, some purpose to the activity that you're doing, and you want it to be an interaction where it's of high quality, so that it's meaningful interaction that you're engaging in. So when you can move to the next slide. And so what I'm going to do with all of these strategies is I'm going to talk about the strategy itself, what I mean by it, and then I will talk a little bit about different techniques or different tips that you can use to enact each of the strategies. So in terms of social engagement, it's important to focus on activities that you enjoy. So you don't want to just go and do things that you don't really find interesting. If you don't really like reading, there's no sense joining a book club. If you don't enjoy helping out others, then there's no sense joining a service organization like the YMCA or Boys and Girls Club or some other sort of organization like that. So you really want to focus on activities that you enjoy. You want to make sure that you interact with people of all ages. So not just interacting with your age peers, but middle-aged individuals, very young individuals, kids, these sorts of things, because they all provide a different type of interaction and different experience for you. You want to try new sources of engagement. So if you're somebody who is socially engaged and you are involved in council on aging activities or uh, other forms of social engagement, you want to make sure that you continue to try new things that might be of interest to you. If you have difficulty getting out, make sure that you're asking somebody for help. If that means, transporting you to and from a given location, or even ideas about how you can become more socially engaged. If you know somebody who is more socially engaged than you are, those are something else that you can do. And again, of course, making sure you diversify your activities, and diversity is going to be something that kind of is consistent throughout all of these different strategies. Okay, so the first one is social engagement. So you want to make sure that you are consistently engaging in social activities. Oh, and you can move on to the next one. And so the next one, if you can't guess by the picture, is to make sure that you're engaged in cognitively stimulating activities. Okay, so you can move to the next slide, Owen. So what do I mean by cognitively stimulating activity? So part of your cognition is your memory. And the other parts of it include like your thinking skills. And cognitive really means thinking skills. So you're looking at your memory, you're looking at your attention, you're looking at language, and you're looking at visual spatial skills. So these are some very common examples of what we mean by um, cognition and cognitively stimulating activities. And these are activities that are mentally engaging. They could be exercises that challenge a person's ability to think. Okay, so thinking beyond your typical way of thinking or what you're used to. The terms for cognitively stimulating activities run. There's a lot of different terms for this. So mental challenges, mind teasers, games, education and learning, using your brain, intellectual stimulation. So what we're really thinking about here is doing activities that stimulate your thinking and challenge your thinking. Okay, you can move to the next slide. So what we are talking about here, these are different ways that you can become engaged in cognitively stimulating activities. So you want to find new ways to stimulate your brain. So getting out of your routine, trying something different, something that is causing you to think, that's engaging, your memory, your attention, your processing speed, whatever that may be. You want to engage your brain with somebody else, so interacting with other people. So as we said, social engaging activities, if you're doing something new, that would be considered something that's cognitively stimulating. Again, making sure that you choose activities that you enjoy. And the reason why you want to choose activities that you enjoy is that you're more likely to continue these activities. And we know that doing any activity that we suggest for only a short period of time is only going to provide you with short-term risk reduction. And so in order to maintain your decreased risk of developing some sort of brain disorder or improving your brain health, you want to maintain activity. And making sure that you enjoy activity is one way that you can consistently do it. You want to, make it easy on yourself. You don't want to try something that's going to feel like it's defeating or something that that you just can't physically do. You want to aim for deliberate practice, a purposeful activity. And then accountability is also important. And accountability is important for a number of these different strategies, but you want to find an activity where somebody else will notice that you're doing this and somebody that you can be accountable for, or even somebody you can do it with. So, joining a book club, you would be accountable to the other people in the book club. If you join a service organization, junior league or something like this, you would then be accountable to that, serving on a community advisory board or something of that nature. Again, you want to make sure it's something that you're interested in, and choose activities that involve both mental and physical engagement. It's sort of a combination or sort of a multi-component types of activities where you are engaging not just the mind, but the body, because if you're engaging the body, you are at the same time also engaging the mind. So it's very important to try to find activities that stimulate more than just one area of your thinking. Okay, we can move on to the next one. All right, and so here, what we're talking about is maintaining your cardiovascular and metabolic health. And so what I mean by that, when I say cardiovascular, I mean things that pertain to the heart. So you want to do things that are going to help your heart to function and to maintain its function. So decreasing your blood pressure. Atherosclerosis, doing things to prevent, buildup in the arteries, to prevent strokes, heart attacks, these sorts of things. So we're talking about doing things that help your heart to maintain its function. And then when I say metabolic, I mean things related to diabetes. So reducing your risk of developing diabetes. Okay, you can move to the next slide. And so the strategies that we're talking about here all pertain to reducing blood pressure and sugar, your blood sugar levels. And these are important because we know that people who have lower blood pressure and lower blood sugar are at lower risk for developing brain disorders, developing cognitive decline, dementia, and these sorts of things. So it's very, very important to maintain your heart health. A healthy heart is a healthy brain. And so you want to do things that reduce your blood pressure, and your blood sugar. And these strategies are consistent for both. So one of the main things you want to do is that one of the main things you want to do is see your doctor. So make sure that you are regularly going to your doctor to have your blood pressure checked, to have your blood sugar analyzed, and all the other things to make sure that your body's functioning at its optimal levels. And then if you're on medications, you want to make sure that you continue and regularly take your medications, because those will help you to maintain a healthy heart. And then, of course, things that I know that you've heard before, but exercise is going to be very important for blood pressure control and for reducing diabetes and helping your body just to function better overall. And then your diet is also going to make a significant difference here. So in terms of blood pressure and glucose, what you want to do is you want to reduce your salt, which will help to control your blood pressure. And you also want to reduce the amount of sugar that you're intaking in your body so that you can lower your blood sugar levels and hopefully decrease your risk of developing diabetes. And even if you have these conditions, making changes to your diet and physical activity will help you to better manage these conditions in addition to taking your medications. Okay, so the next one is sleep, and sleep is very, very important for everybody. We know that there's increasing evidence of the importance of sleep and how having poor sleep or poor sleep quality adversely affects your health in terms of cardiovascular disease, metabolic conditions, conditions of aging, and your memory. So you want to make sure that you're really paying attention to your sleep. We know that as you age, that people can experience more sleep problems. Okay, and having changes to your sleep as you age is normal. So it's not abnormal to have changes. Um, but you also have to be aware when these changes to your sleep constitute, a significant problem that you then need to go see your doctor about. So as people age, they tend to sleep a little bit less deeply. There can be more morning awakenings, and they become a little bit more vulnerable to disturbances, light, sounds that may disturb your sleep or actually wake you up from sleep. And so so some of these disorders that you could experience could be sleep apnea, where you stop breathing during the night and then you sort of wake up gasping for air, or suddenly wake up in a startled uh, position. And then we also know that there's sleep problems that could occur where people, have insomnia, where they're not able to fall asleep or where they're not able to stay asleep. So those are the two very common sleep disorders. And those can affect your memory and can affect your cognitive skills. And it's important to note that if you are sleepy during the day, like excessively, that is not normal. And that is something that you really need to see your doctor about. Um, so, in terms of maintaining proper sleep, one of the major things that we want people to strive for in terms of setting a goal is 7 to 8 hours of sleep. Okay. And also having a regular routine to your sleep. So, going to bed at the same time, getting up at the same time. These things will help to maintain proper sleep. You also want to avoid long naps and during the daytime. And so, what I mean by a long nap is something that lasts longer than 30 minutes. You really want to keep naps shorter than that. And here again, as we talk about strategies that kind of cut through, um, these different suggestions we have, is getting regular exercise. Regular exercise does help to improve sleep. So you want to make sure that you're doing these things. Avoiding caffeine after lunch, because we know that caffeine is a stimulant and so could disturb your sleep. Restricting food and liquids 3 hours before you go to bed is also very important, so that you're not waking up going to the bathroom, and that's that your body has enough time to process the foods that you've eaten. And again, sticking to a schedule. You want to avoid devices before you're going to sleep. In terms of being on your iPhone or your iPad. These kinds of things. And keeping the bedroom dark and quiet is also very key. So again, sleep quality is another strategy that can help you to maintain a good memory and cognitive health. All right, so our next strategy is diet. And we know that diet impacts brain health. We know that those individuals who maintain a healthier diet have a lower risk of developing dementia. And so by healthy diet, we have all these indices for what is a healthy diet. And so any of these different strategies, any of these indices that you adhere to are going to increase your likelihood of having a better memory and brain health. And so, um, it's important to know that you can change your diet at any point in time, and you can get benefits from changing your diet. And again, as Owen said, there's no food here. There's no one food that's a silver bullet. And so it's really a combination of foods, and it's a pattern of eating. And so, think about it this way: that you want to eat from the rainbow. You want to take in a lot of nutrient dense foods. Okay. So you want to eat more fruits and vegetables, more whole grains, fish, fat-free foods, beans, nuts, legumes. These are the kinds of things that are associated with better brain health. You want to eat less of the sugars, the salts, high-fat foods, those kinds of things. And just in terms of just overall strategies, you want to do all things in moderation. So as a good example is nuts. So nuts are associated with good dietary practices and good dietary indices. But if you eat too many nuts, they have a lot of fat. And so you have to eat nuts in moderation. So making sure we eat and consume things in moderation. And this also applies to portion sizes, because we know that there's a proper portion size for each of these different categories. And so you want to make sure that your portion sizes are accurate. Healthy snacking is okay. It all depends on what you're snacking on. Don't snack on Snickers, snack on an apple or snack on, some nuts or things of this nature. And then making sure that, food safety is important. So washing your hands and the surfaces, try not to cross contaminate, and cooking foods at the right temperatures. All right. And so our final strategy that we have for you is physical activity. And what is physical activity? Physical activity really is just bodily movement that's produced by your skeletal muscles. So movement that you produce by your muscles. So when you walk, you're engaged in physical activity. Walking, running, dancing, swimming, yoga, these sorts of things. And then exercise would be planned, structured activities that you're doing. So if you are going to the gym, make sure you get on the treadmill and then you're hitting the weights afterwards. That is what we mean by um, exercise. So our government has recommendations for physical activity. And what it recommends is that you do 150 minutes of aerobic activity at a moderate to vigorous intensity. And you're exercising 3 or 4 days out of the week. However, or I'm sorry, 4 more days out of the week. But it doesn't just talk about aerobic activity. So it also talks about strength training or muscle training. Okay. And so what you want to do here is you want to do activities that strengthen the muscles that are in the body and the large muscles, importantly. And this doesn't mean that you have to go to a gym and try to bulk up in order to engage in these activities. You can do these activities at home. You can do squats at home. You can use cans of food to do bicep curls or to do to work out your shoulders and things of that nature. You can also buy exercise bands. So these strength activities do not necessarily have to be done in a gym. And so to think about physical activity, it's important to think about FIT, which is an acronym. So F stands for the frequency. We know you're supposed to do that 4 more days. I is the intensity, and we know that it needs to be moderate to vigorous, which means that while you're doing the activity, you can talk, but you can't sing. And we also the first T is for time, and so you want to aim for 150 minutes a week. And then the second T is the type, and that would be aerobic and strength. But it's also important to do balanced exercises, because we know that if you have an improved balance and stability, then you're at less risk for falls. And then also you want to do stretching to help keep the muscles and the joints flexible. Okay, so different things that you can do for all of these strategies, especially when we're talking about hypertension and diabetes. You want to, go see your doctor, get information, get on medications, have regular checkups, somebody to be accountable to. And then altering your behavior applies to many of these things. So if you're not sleeping regularly, if you don't exercise regularly, if you don't eat a healthy diet, then you need behavior change, and you need to be able to have some simple strategies on how you can make these changes. So you can move to the next slide, Owen. And so here are some ways to change. You can hit the first one. So monitor your activity. If you have an app, or if you prefer paper and pencil, write down the activities that you're doing in terms of days when you go out to exercise, the kinds of foods that you want to eat, or what you have eaten, those kinds of things. You can hit it again. Accountability and support. Involve friends and family. If you can exercise with somebody safely because of COVID, or you want them, you guys got to try recipes together, these sorts of things. So involve family and friends, because it can provide a lot of support for you. Go ahead. And then you want to set goals. Okay, so don't go out and try to say, next week I'm going to walk 150 minutes, because you probably make it for 2 days. You'll be so sore that you have to sit down for a week. Set realistic goals. Next week I'm going to go for 3 10-minute walks. Build up your confidence. Start slow. Have a gradual increase into your changes to your activities. Don't just say you're just going to give up sugar. Gradually cut down on the amount of sugar that you eat on a regular basis. And then watch out for signs that you're slipping, that you're going back to your old ways of behaving. Okay, so let's talk a little bit about research participation and why it's important and disparities. You can move on to the next slide. So why is it important to be involved in research? Research is how we as scientists figure out what's best. All the recommendations that we talked about, all this information that Owen provided you about memory was based on research. We did research to show that engaging in more physical activity will reduce your risk of developing dementia and things of this nature. So it's important because it provides us knowledge. It's also important because you contribute to the health of the water population. So the information that we get by people engaging in research, we then go and tell the research community, and we tell our own Baton Rouge community, and we try to get changes in place that are more helpful. And so this is why you see in certain cities, they're more walkable cities. They have bike trails, and they have environmental layouts, city layouts that promote more physical activity. And why you see farmers markets and things of this nature, because it brings the foods to places where they don't have healthy foods and things of this nature. And a lot of this was informed by research. There's personal benefits to people when they participate in research. There's a lot of assessments that we do that are very expensive, that are at no cost to you, and that are very informative to you about how your body is functioning. You get to interact with other people, establish new friendships and connections. And of course, we oftentimes compensate people for study participation. But certain groups tend to be a little bit less represented in research than others. And so, with a lot of our research, it's primarily based on women. So 75, 80% of the studies are composed of women. And so in many of these studies with aging, there's fewer men. And so it's important for men to become involved in research, because it's not always clear that findings that you have for one group apply to another group. And heart disease is a good example. So the symptoms of, say, a heart attack for women are slightly different than they are for a man. And so it's important to have both genders involved. But then in terms of ethnicity, we also know that African Americans are typically underrepresented in research. And of course, that decreases our knowledge about how to address certain conditions within that population. And so, African Americans obviously have reason. There's a lot of concerns based on Tuskegee and other experiments that were done without consent. But it's still very important, especially nowadays when we have a lot of oversight for studies and protections for participants to reduce risk and to make sure that they're not taken advantage of, that all groups participate. Okay, Owen, turning it back over to you.
Thanks, Robert. I'm going to try to get through this last part a little bit quickly so we have plenty of time for those questions. But I'd like to just spend a moment reintroducing people to the Pennington Center. I'm biased because I work there, obviously, but Pennington is really one of the jewels in the Baton Rouge crown. It's an institution that is physically in Baton Rouge, but it has a very, very broad impact. It's globally known for its studies of obesity and diabetes and nutrition that have been going on since its inception a little bit over 30 years ago. But we also do research in aging, dementia, and Alzheimer's disease, other issues that come with aging, such as the ability to continue walking properly and prevention of falls. We do studies of the basic mechanisms by which the body does the things that it does, especially the basic biology of exercise and what exercise does to the body and how the body processes the foods that you eat. We also have areas in all of these things applied to pregnant moms gaining too much weight, developing gestational diabetes, and so on. And then a very important part of our research portfolio is trying to prevent kids from gaining too much weight and having the ill health effects of that childhood weight gain carry on throughout their lifetime. So we're constantly doing research on human beings and also small animals. And at any point in time, there might be 5 to 10 to 15 studies that are bringing in people for various procedures such as MRI scans or blood draws or cognitive tests. And again, like Robert said, using that information to change something, either change how doctors evaluate their patients, change how policies are laid out to determine whether we have farmers markets or walking paths and so on. So just a taste of few of the studies that we have going on now and coming up in the future. One of the rules of Pennington, I'm not sure why this is true, but one of the rules that we have is that every study seems to have a catchy acronym. So we have one study that is going on right now called the RATE studies. That stands for Reducing Risk of Alzheimer's Among African Americans Through Exercise. And it gets back to this point that Robert made that that certain race and ethnic groups are underrepresented in research. And in particular, we have a pretty good sense that exercise contributes to better brain health as you get older, but most of that evidence comes from white people. And so there's a risk, I don't know how likely this is, but there's a risk that that exercise could help white people in ways that are different than African Americans due to differences in the history of those people and the kinds of environmental exposures that both of those groups are exposed to. So in these studies, we are recruiting African American older adults, and they will get randomized to either go into a 1-year exercise program or an educational program to talk about things that people can do to age successfully. We'll do many different procedures before and afterwards to evaluate how well this exercise program helps to preserve the brain health of the people over the course of that year. And then, of course, the big question is going to be, did the people who are on the exercise plan have improved brain health? And if so, more or less than or about the same as the people who took the classes? Another study that we have coming up or that's going on now is called MotorPack. It's a kind of a technical term because it's called Molecular Transducers of Physical Activity Consortium. And that term transducers is really a high-tech sounding one. It sounds like something that you would have inside your laptop computer or your cell phone. But it all comes down to this. On average, if you give 1,000 people an exercise plan and they all do the exercise, on average, those people will benefit. They'll have stronger hearts, stronger muscles, better blood vessels, and the brain will be helped too. But there's a lot of variability from person to person in terms of how much they benefit. In fact, there's some people out there who get put on an exercise plan, actually do the exercise, and they don't see much change to their muscles or their heart or their blood vessels at all. And scientists don't know why this is true at all. So this MotorPack study puts people on a 3-month exercise plan and measures all sorts of genetic and other kinds of molecular changes over the course of that exercise plan to figure out what happened to the people who benefited a lot in terms of their heart and their muscles and so on, and what happened in the people who didn't improve very much at this molecular level, so that in the end, we might be able to do something like have you do 23andMe or Ancestry.com to do a cheek swab and get your genetics and use that information to tell you what kind of exercise you ought to do to benefit you the most. So the Bogalusa Heart Study, I think a lot of you know where Bogalusa is, right on the close to the Mississippi border to our east. What we're doing there is taking people who are a very special group of individuals who were raised in the Bogalusa area back in the 1970s. They were studied very carefully starting in childhood and have been studied by medical researchers all the way from childhood until now when they're in their 50s and 60s. So these people will get MRI and PET scans in Baton Rouge. And the big question that we have is, let's say that for whatever reason, your parents didn't have the resources or the knowledge or the wherewithal or the whatever to provide you as a child with a healthy diet, to sign you up for after school activities that give you exercise, to provide you with a good sleep environment and things like that. Does that bad experience that you had when you were a kid carry on all the way to old age? Do you carry that with you like luggage and eventually leading to you having a higher risk of Alzheimer's disease when you're 70 or 80? And the real kicker is, what if you have that kind of bad experience as a kid, but then as an adult, you change your life around. You pull yourself up by your bootstraps, you join a gym, you learn how to cook, and you get healthier. Are you able to dial back the bad things that happened to you when you were a kid, cast off that luggage of bad health experiences from childhood? Or do you continue to carry that with you anyway and go on to have a higher risk of Alzheimer's disease no matter what? Finally, we do COVID research, unlike just like any other institution that can do research. I think even though we're not an infectious disease center, like every other medical researcher out there, we tried and tried and tried to find ways in which we could have a positive impact on the signature health crisis of 2020. And so Robert and I have started efforts to try to see how the pandemic has changed diet, physical activity, and sleep habits of people in the Baton Rouge area. So I know personally, and maybe this is true of you too, there are anecdotes that go in completely opposite directions. I've talked to people who can no longer go to the gym and therefore are sitting on the couch gaining weight during the pandemic. I've talked to other people who have so much free time on their hands because they're no longer commuting by car to work that they've taken up jogging, or they've learned how to cook and are now eating more healthy meals. And so these health changes that are caused by the pandemic can really go in opposite directions. And we're trying to get our hands on what kind of health changes happen to what people. And the goal here is that nobody likes to talk about the next pandemic while we're currently in this pandemic. But I think it's prudent for us to prepare for the next infectious disease crisis that might hit us and be ready at that time to provide messages to people and to provide tips for how they can maintain their health, even though their life has been turned upside down by a pandemic. So in particular, how to transition from going to the gym to exercising at home, how to transition from picking out food at the grocery store all by yourself to having it delivered to you, things like that. And then finally, one of the themes of the pandemic is that it hasn't just messed up care for infectious diseases, it's messed up care for everything. And in particular, if all the nurses in a hospital are taking care of COVID patients, they don't have time to take care of heart attack patients and so on. We're also talking to people about medical research, because if people don't want to go to the hospital for their own medical care, they certainly don't want to go to the hospital to take part in a medical research study that's, like Robert said, required to develop the next generation of treatments and cures for diseases. So on the horizon, and I'll just go through this very, very quickly, we have two studies that are really trying to expand our ability to do medical research in older African-American adults. So this program for African-American Lifestyle Management, or PALM, is trying to throw the whole kitchen sink at older adults, have them improve their diet and their physical activity and cognitively stimulating activities all at the same time, to see if those all work together to improve health, or if it's just as well to do them all individually. The second one is called Innovative Strategies to Recruit Older African American Adults into Clinical Trials. And this has to do with how we provide messages to older African American adults about medical research, how we communicate with them, and instead of just treating ourselves as a company and them as clients, to think of it as more of a mutually beneficial relationship where we build up trust, they trust us, we trust them, we get input from the community about what's important to them, what kinds of research studies they're the most interested in participating in, and so on. And then Look Ahead PET is another study that very briefly is about having this kind of lifestyle change in people with diabetes and seeing whether in the specific context of type 2 diabetes, lowering weight, losing weight, getting people to exercise lowers the risk of brain diseases such as Alzheimer's or not. This particular study did not lower people's risks of getting heart disease by putting them on an exercise plan and lowering their weight, but we're not sure of whether it did so for Alzheimer's disease. And if it did lower people's risk of Alzheimer's disease or other brain diseases, we don't know how exactly that worked. So we're studying that as well. Okay, COVID, the the elephant that is in every room in early 2021. So we are doing medical research at the Pennington Center in 2021. And it's the most important message here is that we've kind of re-engineered our whole approach to wrap itself around the COVID pandemic. And in particular, we start from one operating principle, which is that safety of research participants and staff is really our number one priority. We halt studies altogether and grind everything down to a halt, if local COVID statistics are too high. We have modified and we continue to modify all of our policies based on the current knowledge and recommendations from the Centers for Disease Control, the Louisiana Department of Health, and the governor's office. And just a couple of practical steps we've taken is to reduce the number of people and the density of people that are physically at the Pennington Center. And so, for example, if we have 10 exam rooms that are doing procedures on people, we're not going to have all 10 of them filled with people all at the same time. We'll have some kind of a staggered schedule where every other one is empty for an hour to let the air in the room cycle out. Instead of having people sit crammed into a waiting room side by side, we might tape off 3 or 4 of those chairs so that people are distant from each other. We instituted quarantine policies for people who get infected, both staff and participants. And an important thing is that when the situation changes, we change. Obviously, it's impossible to just assume that we've learned everything that we can learn about COVID. We're learning new things all the time about this disease. So, for example, vaccines. How exactly do we incorporate research participants or staff who have gotten the vaccine into studies, and how do we logically go through how we think about that? So here's just some examples of ways in which COVID has affected us. This is a very large room. You can see from the layout and how large the chairs are. This might be a good room to have an exercise class where people are spaced out 10 or more feet apart from each other with plexiglass partitions between them. Hopefully that gives you the impression that there is a large airspace between people. Here's another classroom with chairs laid out in a spaced out fashion. And this would be the kind of setup that we might use for an educational course, with people able to participate and talk to an instructor while still being spaced 6 or more feet apart from each other. Let's see, this is the kind of, it's hard to see, but this is the kind of plexiglass partitioning we use. We roll them in between desks that have people at them, or in between people who are exercising, so that the different participants don't share airspace. And we have setups like this where in an exercise class, there'd be a group leader all the way to the left with plexiglass between him or herself and the rest of the class. And all of the participants in the class are at least 10 feet apart with these partitions between them. So we think that this gives us the best shot at providing a safe and still effective environment where you can actually exercise while doing contributing to medical research. And another thing that I should say is that we're blessed at Pennington with space. So we have large air spaces, very wide hallways in which people can move around without finding themselves crammed into spaces close to other people, which of course is something that the CDC has consistently told us not to do. So, the other thing that we're blessed with is outdoor space. So we have this large lake that's sort of behind our buildings on Perkins Road. And we've used this for exercise courses as well. And of course, anytime we can go with outdoor exercise, we will do so. And we're not naive. We know what the weather's like in Louisiana. We know that this is not a 12 months out of the year solution, but we do have this option when the weather is all right. So at this point, that's the messages that we have for you. And if there's time, it looks like there's a little bit of time to go through questions. Ellen, did you want to field those?
Yeah, that'd be great. So the first question is, what is the most promising medications coming out regarding memory loss? That's the first question.
Right. So I don't mean to be a downer here, but there's really not that much. And honestly, in terms of medication, the most highly promising medications are vascular ones. So being strictly taking the heart disease medications that your doctor prescribes for you is as effective or more effective than any drug that's been prescribed for the purpose of memory loss. In fact, the only drugs that are proven to work well for memory loss are for people who already have Alzheimer's disease. So for prevention, there's really, really not very much, unfortunately.
Okay. Can you talk about how far along they are in clinical trials for any of the newer medications or anything like that?
Sure. So there is just last week, a promising what we call phase 2 trial, showed positive results for, again, this is in people with mild Alzheimer's disease already. So this is showing that people who already have Alzheimer's disease decline at a slower rate than people who, if you got the drug compared to if you didn't. But again, this is what's called a phase 2 trial. It's not the definitive 50 sites in the United States, thousands of people, be all end all kind of trial that would get the thing approved by the Food and Drug Administration. This is a stepping stone that will take you to that.
Okay. Do you think you have time for one more?
Sure.
Okay. Is there any data that shows turmeric prevents or lessens the incidence of Alzheimer's disease? And if not, are there any other supplements you'd recommend?
I think this goes back to that silver buckshot idea. I think that I had a list of green tea extract and vitamin E and so on. I would add turmeric to that list, where by itself, just taking people as they are and adding turmeric to it doesn't seem to help. However, if turmeric is one of 20 different ingredients that you consistently eat in a diet that's of the type that Robert recommended, and you do that for long periods of time, it could be beneficial. But by itself, it's not a silver bullet.
Okay, last question. I have a family history of Alzheimer's. My mother and her father both started showing signs in their mid-60s. At what age should I start memory testing, and how do I find a doctor who performed that testing?
Right. So, what I recommend to people is that they get in contact with the Pennington Center's Institute for Dementia Research and Prevention. So IDRP, and that's easy to find on the internet. What they do is they have a research cohort of people who express that they are interested in being involved in research studies. And what they get as part of that is a yearly cognitive screening evaluation, where they do cognitive tests once a year. And in that way, you can see what your tests are doing over time, if they are declining a little bit, or if they're declining rapidly, or if they're staying stable. And I think that's especially useful because just taking one test at one moment in time it's awfully hard to figure out, just based on that one moment in time, whether you have some kind of an illness or not. Obviously, maybe this makes a lot of sense, that if you see what happens to you over time, if you're stable or if you're declining, that gives you a lot more information.
Awesome. Well, thank you both, Dr. Carmichael and Dr. Newton, and thank you to everybody who joined us today. It was a wonderful presentation. We look forward to having you guys again in the future.
Thanks for having us, and thanks everyone for listening.
Yep. Thanks for having us. Appreciate it.
Have a great day.
All right. You too.
Take care.